Good day, ladies and gentlemen, and welcome to today's webinar, Engaging Mothers and Improving Co-Parenting Among Unmarried Parents. All lines have been placed on a listen-only mode, and the floor will be open for questions following the presentation. If you should require assistance throughout the conference, press *0 on your telephone keypad to reach a live operator. At this time, it is my pleasure to turn the floor over to Jessica Pearson. Ma'am, the floor is yours.
Thank you, and welcome to everyone. This is the third learning community sponsored by the Fatherhood Research and Practice Network. I'm Jessica Pearson. I direct the Center for Policy Research in Denver, Colorado, and I'm co-director of the Fatherhood Research and Practice Network. We're delighted with the overwhelming interest in today's webinar topic, Engaging Mothers and Improving Co-Parenting Among Unmarried Parents. And I want to take a few moments to acquaint you with the FRPN. This slide shows that that the network involves many experienced and energetic researchers and practitioners in the fatherhood field. It's co-directed by me and Jay Fagan, Professor of Social Work at Temple University. Our Senior Research Coordinator is Rebecca Kaufman at Temple University, and Nancy Sonis at CPR rounds out our core team. We also enjoy the support of Vivian Gadsden at NCOF, the Bauman Group, a marketing communications firm in Denver that has designed and updates our network and website, and approximately 40 leading researchers and practitioners in the fatherhood field who help us identify key questions that need to be addressed to move the fatherhood field forward and advise us on how to be an effective resource for researchers and practitioners in the fatherhood field. The FRPN is a $5 million grant, approximately $5 million for 5 years, funded by the Office of Planning, Research, and Evaluation. Next week, we begin year 3. We have 3 major goals. One is to promote rigorous evaluation of fatherhood programs that serve low-income populations. And to that end, we fund fatherhood researchers and practitioners to conduct rigorous evaluations. So far, we have made 4 awards to research practitioner teams. They've been based in home visitor, ex-offender, Head Start, and community-based settings. And next round of RFPs will be released in January 2016. So please check our website, and we expect to make approximately 5 to 8 awards at that time. We also strive to build evaluation capacity in the fatherhood field by providing training, technical assistance to researchers and practitioners. We sponsor webinars like the one we're doing today. We offer a 1-day training program on evaluation research at leading practitioner conferences, which results in a Temple University certificate in research and continuing education credits in social work. We help researchers and practitioners find one another, and we design new measures of fatherhood program outcomes like father engagement and father-child contact and co-parenting that are particularly tailored to work with low-income, unmarried, and non-resident populations. So that is, those are some of the ways we try to build capacity. Finally, we are committed to disseminating information to both research and practitioner audiences, and we have our chief vehicle for doing that is our website, www.frpn.org. FRPN.org. You find research briefs, measures of fatherhood outcome, videos showing you how to use the new measures, a listserv that you can sign up to be on, an electronic newsletter, new research highlights in the fields, and papers on research gaps in the fatherhood field that are committees of researchers and practitioners have prepared. Our audience is a broad range of programs serving low-income fathers. We work with OFA and non-OFA grantees, state-sponsored fatherhood commissions, programs linked to Head Start and Early Head Start, programs funded by states, local child support agencies, TANF programs, child welfare agencies, and community-based organizations. So please contact us and become a participant of FRPN and a recipient of all the information that we are generating and exporting. Why a webinar on engaging mothers and co-parenting for fatherhood programs? I think the research is overwhelmingly obvious that contact with both parents and in the absence of conflict is the best strategy for child well-being, that children born to unmarried parents are more likely to experience negative outcomes, in part because of low father involvement, that mother-father relationship quality is a consistent predictor of father involvement, that paternal involvement is, regardless of marital status, is greater among fathers described by mothers as supportive partners, that couples can have positive co-parenting relationships even when they are no longer romantically involved, and that as families change, regardless of marital status, fathers residential status, strong interparental relationships can be decisive in child well-being. So I think many programs are attempting to determine how they can help parents manage conflict and collaborate and help their families engage in low-conflict co-parenting relationships. A huge stumbling block has been opportunities or attempts to engage mothers, and for that reason we have crafted today's panel with some leading researchers and practitioners who've been working in this field. And I'm going to briefly describe who they are and then turn the program over to them. We are going to hold questions until the end, so you keep track of those, and you'll have an opportunity during the last half hour of the program to direct them to them. We're going to start off with a presentation by Paul Floorshine, who's a professor and director of the School of Public Health at the University of Wisconsin-Milwaukee, and he will be talking about the definition of really what co-parenting relationships are, how they fit in the network of relationships between parents, and what research to date has shown about co-parenting and what is needed to move the field forward. He'll be followed by a presentation by Leandra Davis, who is a mediator with Family Pact in Coshocton, Ohio, and has been working on fathering and co-parenting curricula and training using 24/7 Dads, Understanding Dads, and Mom as Gateway. Following Leandra, Judy Williams, who is a program manager for Action for Children in Columbus, Ohio, will talk about their efforts to engage mothers and work on co-parenting using Father Factor and Mothers Matter. And our last set of presenters will be Anthony Mingo and Tashana Gregory of the Richmond Family and Fatherhood Initiative, who will be talking about their efforts to engage mothers and fathers in co-parenting interventions using the NPCL curriculum, and they are with the Virginia Department of Health's Richmond City Health District. Okay, the first up is Paul Floorshine on his presentation about co-parenting.
Hello. Thank you, Jessica, and I appreciate that introduction and the general introduction. I'm actually having a hard time somehow seeing the cursor for me to move my own slide forward, so I'm going to ask that perhaps somebody else can, and I'll just indicate when I want to move forward. So I was asked by Jessica and Jay to speak for about 10 minutes about the state of research on co-parenting with unmarried couples. And while this may seem like a daunting task to accomplish in 10 minutes, I think I can manage it in about 2 minutes because we know relatively little about how to help unmarried co-parents work together. So for my 10 minutes, in addition to talking about what has been done, I'm going to focus on a couple of important issues that are intended to help us think about what to do next. First, I will address why co-parenting interventions with unmarried parents have been so difficult to implement. The first point I want to make is illustrated in this figure taken from a recent Child Trends publication, which illustrates the fourfold increase in the percentage of children born to unmarried couples from 1970 to 2013, so that currently about 4 in 10 babies are born to unwed parents across the demographic spectrum. The rates are much higher among young, impoverished people of color, but the issue has become truly universal because marriage is just not as compelling as it once was. I'm sure this information is not news to any of you. The point of showing this slide is to remember that our definition of what it means to be a family has changed dramatically. But as a society, we have not been able to find reliable ways to make up for that change. It seems to me that we've been spending a lot of time and money and energy trying to bring marriage back, to restore the institution to what it was in the 1960s. Marriage is not dead. People will continue to get married, and that is a good thing because marriage is good for the health of mothers, fathers, and children. But if we rely on marriage to be the only way to provide a secure, stable childhood for our children, then we are in big trouble. If we cannot count on marriage to stabilize society, then we need to build up other institutions to provide that ballast and support. The work of co-parenting counseling and education is hard because the task is enormous. It's going to take us a while to figure this out. If you could go to the next slide. Anybody? Yeah. The second point I want to make before talking about the research findings is illustrated in this Venn diagram. With this diagram, I want to both acknowledge that there's a lot of overlap between co-parenting and romantic relations and child-rearing, but to also emphasize that we need to be more clear about the focus of co-parenting interventions. If we focus on couples' romantic relations as the anchor for families, we run the risk of disappointing everyone involved, including mother, father, child, counselor, and researcher. I believe that the part of the diagram that needs most of our attention is the part outlined in the red box. By emphasizing the value of parents working together to provide secure homes for their children, regardless of what happens to their romantic relationship, we will more effectively keep both mothers and fathers at the table. If you could go to the next slide. From my perspective, there are 3 simple co-parenting goals for unmarried parents. The first goal is to decrease hostility and violence and to help parents learn to manage conflict more effectively. Assuming that the child will live primarily with the mother, which I recognize is not always the case, the second goal is to support the father's involvement in his child's life. This might mean hands-on child care like diapering, telling bedtime stories, cooking and feeding, that sort of thing. It might also mean providing by paying for food, shelter, clothing, and all that other stuff. Of course, most fathers do some of both, and many are better at one than the other. The third goal is for co-parents to provide support to each other through positive feedback, stress reduction, coordinated problem solving, and listening. The skills involved in achieving these three goals are each directly related to child rearing skills, and in this sense, working with parents on how to function as co-parents is also helping them develop the skills necessary for parenting. If we can agree that these are the fundamental goals of co-parenting programs for unmarried parents, then the next question is how are we doing as a field with respect to meeting these goals? Next slide, please. Oh, actually, you're already there. Only a small number of programs for unmarried parents have been developed and tested. Until relatively recently, father programs have not focused on co-parenting issues. And until very recently, co-parenting programs have not focused on unmarried parents. The largest and most complex study of co-parenting interventions with unmarried parents was the Building Strong Families Study, or BSF. The BSF study implemented different co-parenting programs across eight sites, and the results were disappointing. In summary, there were no overall effects on relationship quality, co-parenting, and family stability. There was one site in which couples that participated in the BSF intervention reported more family stability, meaning that couples were more likely to stay involved in living together. There was also one site in which the parents and the children in the intervention seemed to be worse off than the control group, raising some important questions about the potential for negative or iatrogenic effects. Several issues may have contributed to the lack of findings. First, couple attendance and retention rates in the co-parenting programs was quite low. Second, there were high levels of psychological stress among participants, which may have interfered with program engagement. Third, most of the programs focused on the couple's romantic relationship as an important part of the co-parenting relationship, which may have been a deterrent for some. Recent small-scale studies have been more promising. For example, in our Young Parenthood study, we found that participants randomized into the program were less likely to engage in intimate partner violence or hostile verbal exchange. Similarly, in a 2015 study by Jamie McHale and his collaborators, fathers who participated in the Figuring It Out for the Child program were observed to have lower rates of negative behavior, such as aggression, coerciveness, and control. McHale also found that participants were observed to be more supportive, cohesive, and positively engaged with each other. Although the McHale report was based on a study that did not include a control group, the findings are encouraging, and I'm looking forward to the results of a more rigorous test. And in 2008, Jay Fagan published the results of a study focused on MELD, which is a co-parenting program that targets fathers only. Interestingly, Jay found that the partners of the young fathers who participated in MELD reported higher parenting alliance scores than the partners of fathers in the control group. Both the Young Parenthood program fathers and the fathers in Fagan's study reported higher levels of positive father involvement in parenting. While there has been some progress toward the development of programs designed to stabilize unmarried parents, progress has been quite slow, and I want to spend a few minutes speculating as to why this may be so, focusing on 5 primary issues. If you could go to the next slide. The first one is what I've already mentioned, what all of you are doing very hard. Changes in family structure have had an enormous impact on the development of men, women, and children, and since we cannot turn back the clock, we must find new ways to support family stability. Second, father engagement and co-parenting support services are not owned by healthcare institutions. Some years back, Michael Liu wrote an important paper suggesting that fathers be included in maternal and child health care. I think many organizations and institutions aspire to be more father and family friendly, but these aspirations have not really translated into full ownership. Third, programs are not sufficiently prevention-oriented. We need to help fathers and mothers earlier in the co-parenting relationship before problems and resentments could become entrenched. Fourth, co-parenting interventions often focus on the romantic relationships and overlook important elements of co-parenting. Fifth, the tendency to deliver programs through the use of multi-couple groups may be limiting progress. Although I enjoy working with groups and fully appreciate the power of the group process, I think this approach is not logistically feasible for many disadvantaged populations that have little control over their schedules. Next slide. I do not want to leave with a slide that only diagnoses the problem, because I do think that there is plenty that we have learned over the years, and I see some important, tangible next steps. Remember that almost no one seeks co-parenting counseling, so we must be clever about recruitment. Provide incentives, including financial incentives like cash or baby incentives like diapers. We have recently developed a strategy designed to provide internal incentives by helping fathers and mothers identify their own motivations for improving their relationship. And we're having some good luck with this. Use windows of opportunity when mothers and fathers are most likely to be motivated to work together. In my own work, I've relied on a strategy that involves recruiting fathers through mothers rather than mothers through fathers, who are often more elusive. Early in my career, I learned that the best way to find fathers was to find young pregnant women and enlist their help in recruiting their partners. Second, we must integrate co-parenting counseling and education with other services such as prenatal clinics, pediatric clinics, and early childhood education centers. I'm a big believer in integrated healthcare. Third, we should focus on addressing co-parenting concerns specific to individual couples. By focusing on couple dyads rather than couple groups, our programs can be more flexible and tailored. Focusing on helping co-parents provide a positive family life for their child is likely to be more attractive than helping them fix their relationship problem. And this is what can draw couples and families in. Over the next 30 minutes or so, we are all fortunate to have the opportunity to learn about some established programs that directly address some of the issues that I've raised. I'm very much looking forward to hearing about these best practices in the field of fatherhood programming. Thank you.
Thank you very much, Paul. So next up is Leandra, and in this section of the program, we're going to be talking about practice issues related to co-parenting, outreach approaches, incentives, partnerships, and referral arrangements, and effective co-parenting interventions. We've also asked all of our presenters to talk a little bit about the treatment of domestic violence and safety. Okay, Leandra.
Thank you, Jessica. I am from Coshocton, Ohio, where we do our programming, and we do it rather uniquely. We have a great team of social networks here. We're a small rural community, and we've had our organization open to co-parenting issues since 2006, and that's when our agency, Family Pact, which is an acronym for Parents Acting Cooperatively Together, joined with our Coshocton County Fatherhood Initiative and decided to offer services that would support strong fatherhood in our community. What we saw was an abundance of programming that supported mothers in all aspects of life, whether it be through the WIC program or Head Start programs or even church programs. But we didn't see anything that was helping the fathers in our community. We saw a lot of punitive actions, especially where it related to child support. So our two entities came together and we began offering mediation services, supervised visit services, and parent education services. Typically in a year, we provide services to about 166 fathers, and they get access from school programs, word of mouth, our child support enforcement agency. We have a great referral program through our court system, through our counseling services, whether it be family, individual, or drug and alcohol counseling. and many other agencies. A lot of churches make referrals to us. Even our local county jail makes referrals to us. So what we've decided, once we saw that need, and after we've spoken to so many different agencies in the community, was to begin to listen to the fathers differently. We stopped listening to them say all the things that they can't do and things that are working against them, and started asking them, what do you need? How do we help you? And what we learned was, for as many fathers that say, I've changed, I'm doing things right, but the mother won't let me, we realized that we're still helping more mothers than fathers. We have our programming that began to be inclusive for mothers and fathers, but the primary focus had been on fathers. So our mothers are recruited through the same way that the fathers are, which would be their daycare centers, schools, churches, child support, whatever that venue may be. And often their participation is voluntary. And we serve about 112 mothers a year. Our focus with our services are primarily communication, because after we listen to the people, and especially fathers, they were saying, no matter what I say or do, this mother will not allow me to be an active father for my child. We reached out to those mothers, and their statement was, no matter what he says or does, he's still this certain type of man. So we began to look and research different programs that was out there to help us. And the first program we started was Mama's Gateway, because what we found was the problem was the mother. She was denying access. It didn't matter what type of relationship the mother and the father had. She still needed to understand that she can have a relationship for the father and the child and she not be entangled. And so we hit that program, Mama's Gateway, very hard with a big selling point of mothers. This is how you can allow access between your children and their father, and you not become romantically involved with him. You not become the crutch to hold that bond together. You're not doing all the work, but you are giving him and the child an avenue to be able to be together, to communicate, to shine, to love one another, and be respectful. So in our Mama's Gateway program, it's 4 sessions. Originally, it's 3. It is talking about a mother's role as a gatekeeper. She's the one who decides who comes in and out of the child's life. Then we go on to talking about control in relationships between men and women, understanding that there's always something that you control and something that he controls. But where can you come together? Another thing we talk about are exercises to identify what it is that you do that blocks access and how to begin to allow this access to happen openly and freely, and to be comfortable with this access that goes on between the father and the child. For our co-parenting intervention, we have a program called 24/7 Dad, and that is mainly male-oriented. We have had a couple of mothers who've participated in that class, but it's for dads, and the males are facilitators, and it's 2 hours for each session, and there are 12 sessions. In our 24/7 Dad curriculum, they talk about things such as family origin, masculinity, understanding yourself, handling and expressing emotion, spirituality, and I'm not talking about religion, I'm just talking about within your own self and understanding how to balance yourself. They talk about physical and mental health, fathering and family roles, fathering and culture, discipline, rewards and punishment. They talk about expectations and the child's development. They talk about balancing work and family. And lastly, they talk about getting involved with your children. And what the goal is for a father to understand who he is as a father, what were barriers in his life, and what it is that he wants to overcome. And we give them the tools to be able to begin that journey. Not only do we give them the tools, we help provide the access so that they can then put those tools into practice. And our goal is for every dad we have in our 24/7 Dad program, we try to get that mother to participate in our Understanding Dad program. Our Understanding Dad program is for moms, and we have a male and female facilitator. And we did that specifically because we wanted the mothers to have a male perspective as we're going through our dialogue. And it is 8 sessions long, and each session is 2 hours. So the first session talks about my life as a mom. The next one talks about the father's impact on their child and on you. Then it's the mother's impact. So it would be your mother's impact on you, your father's impact on you. The fourth session is me and my child's father. So you're talking about the relationship that you all had. That, how that impacted on your child would be the 5th session. 6th section is the patterns of communication. 7th session, it talks about open and safe communication. And the last session talks about how to listen. And this Understanding Dad is really about understanding and becoming aware of how you communicate. Because, again, the father would do so many things to show that he's made a change in his life or he wants to be involved with the child, but the mother would stop it. She didn't want to allow that access. She didn't want to communicate with him. She didn't want to even acknowledge her part in anything that's right or wrong in the relationship. So we figured if we can get these fathers to come together and truly show and understand what their barriers are and how they want to do better and be more involved, and we get the mothers together and begin to understand how to listen to these fathers differently, how to talk to them differently, we can begin to have a whole new dialogue about co-parenting. So you take those 2 curriculums along with the Mom as Gateway curricula, and we have created a sort of gumbo for the parents here in Coshocton County to find ways to better co-parent. Our curriculum we received was from the National Fatherhood Initiative. So we went to them and we, discussed with them what it is that we saw here in Coshocton that was missing and what we wanted, and they had these curricula. We were fortunate enough to be the first in our nation to do Understanding Dad and Mama's Gateway curriculum, and they have been very, very well received. A lot of our feedback has been, I didn't realize how stubborn I was being, or I didn't realize what I was doing wrong. And the thing that I really appreciate about these curricula is that no matter what stage you are in parenting, you can find yourself somewhere in these curriculums. They're interactive, they're self-exploring. It's not a judgmental-based program. It's all self-led and self-guided. Here in Coshocton, we also have 2 smaller programs that are sort of grassroots because we figured for those who aren't ready to deal with the heavier issues of really communicating well and allowing that access, we need to start somewhere. And we realized that our new dads and our first-time dads, and by that I mean for those men who are having their first child, or for men who are older and have been in relationships but don't have their own children but are now with a lady who has children. For those type of fathers, they need to understand what this dynamic could look like. So we created a program called Foundation, and that is a 1-hour session. It's on hands-on, and we started that within our local hospital through our birthing unit. So when the parents would come in for birthing classes, they'd sit through that. When the parents would come in and say, I don't know what to do, I've never had a baby before, we would do it on-site somewhere else. From that class, we build on another one called Framework. It's kind of building a house. First, we laid a foundation, and now we're going to build this house. And it's another interactive program with 1 or 2 facilitators, and that has 6 sessions. And they talk about communicating with the other parent, time and commitment for yourself and your child, time and commitment for your work, what discipline looks like, not only for yourself, but also for you and your child. And we're not talking chastising discipline, but knowing when to say things, how to say things, when to go places, where to keep your child from danger, knowing the difference between adult entertainment and adult and child entertainment. So those are the things that we do here in Coshocton for co-parenting. To address our domestic violence and safety issues, we have a vigorous screening process. So whenever referrals are made, there is a screening form that we have created, that we've disseminated to all the local agencies that they complete. And when they submit it to us for service, we then do another screening based upon the information that we've gathered. We have the privilege of being located next to our local sheriff's station, so we have a lot of access through our sheriff's station of being able to help provide safety. So parents come in, and if they're feeling a little uneasy, knowing that that entity is so close puts their minds at ease. Our facilities are fully alarmed, so in a second, if something was to happen, we do have sheriffs at our doors, and they don't need an access key. They have immediate ability to enter into the building through a passcode. So here in Coshocton, it just really resonates, having so many different programs that addresses so many needs individually and collectively, and also having our domestic violence issues addressed through the initial referral process, again, before you enter the programming, and knowing that structure of safety is very close when the parents choose to participate. Some of the benefits and challenges that we've experienced, many fathers have become actively involved. Parents are communicating better, and the children have access to two happy, functional parents. We've gotten so much feedback from our client base, and we've reached out not only to the adult parents in our community, but we've also got a direct tie to our local schools. We have a vocational school that has allowed us to come in and do programming there. We have a sort of night school that has allowed us to come and do programming with them for their young teenage parents. And those parents are a little more difficult to work with, but they're just as captivated by the information that we give them. And I think they're difficult because their issues are slightly different than that of the adult parents because their maturity level isn't quite there. The other challenge is that a lot of the people, because our basic population is a poor population, so those who are not in that class of people feel like the services we provide are more or less welfare services or social services only, and they don't want to be affiliated with that. So we do have a barrier of working ourselves out of that stigma of being a lower class agency only providing service to low-income people. But we do provide service to any and all fathers and any and all mothers who want to have a good co-parenting relationship. Thank you.
Thank you. Next up is Judy Williams, Action for Children.
Good afternoon. Thank you, Jess. Providing Action for Children to participate in the webinar. Action for Children is based in Columbus, Ohio, and we are a little bit different than a lot of the organizations that you will typically find offering fatherhood, motherhood, and co-parenting programs. Action for Children actually was founded in 1972, and our primary goal is to help children in early learning environments, in child care settings, but we help them by working with those adults in their lives that really matter the most. So our mission is to transform the lives of children by supporting, empowering, and advocating for the adults who make the biggest impact on the children's lives, that being the parents, the caregivers, and the teachers. One portion of our organization, one of the ways in which we go after our mission is through our parent services group. We have a number of different parent services programs that do things such as ensuring that the developmental needs of the children are met through our Help Me Grow program. We also help ensure that children are ready for kindergarten through a home visiting program or working out in the community and in child care centers through programs called Columbus Kids and Franklin County Kids. And then we also have parent education programs. Our parent education curriculum is known as the Art of Positive Parenting, or TAP, as we refer to it. That program was actually developed in 1978 and has been offered in the Central Ohio area since then. It became part of Action for Children's umbrella in late 2001. That particular parent education curriculum was initially offered as what I would refer to as general parenting education. So most classes were open to any and all parents. Some of them were a little more focused on the high risk, others more on parents who were seeking to enrich their relationship with their children. But it was something that I would consider to be pretty across the board, open and available to the general population. Over the last, I would say, 8 years or so, we've been evolving the TAP curriculum and began to develop audience-specific programs in 2007. We started first with the population of parents who were going through a high-conflict divorce by offering classes that would help them to be able to co-parent better and to be able to make sure that their children were not being caught in the middle of their conflict. In 2009, Action for Children implemented the Father Factor program, and this was done with funding from the Ohio Commission on Fatherhood. In the initial year or two, the Father Factor program was actually a faith-based program here, and the goal was to strengthen the father-child relationship and to develop mentors at each of the participating faith-based organizations, develop the mentors at each site to go ahead and carry the work forward from that point on. As we moved further into the different contract years and the different funding that was available, the programs began to evolve so that we were going to be targeting the lower income dads and those dads who were not engaged in their children's lives. In so doing, then, we began to strengthen the curriculum and shaped it so that we are now offering the curriculum it's a 13-hour program. It's offered typically over a 9-week period of time. And we really work with the dads by helping them to, first of all, reflect on their role as dad. We ask them to reflect back on what it was like for them as they were growing up, what were the male influences in their lives. We talk about building on the positive to make sure that we not only look at the positive things, each dad looks at the positive things in his life, but the positives of their children. We focus in those first 4 or 5 weeks on the dad's reflecting on his role and his importance in the child's life, as well as beginning to strengthen and understand how to develop the relationships with the children. We move into things like discipline and being able to make decisions at home, and then we begin to focus on the positive co-parenting facets, and I'll speak to that a little bit more on down the road. The referrals that we receive into the Father Factor program come from the different Child Protective Services organizations, child support enforcement, the courts, word of mouth, outreach, community resources. We are currently serving in 7 Central Ohio counties, and we're serving approximately 250 fathers per year. We do this not only through the classes, but with case management and supportive coaching services. And the majority of our funding is still coming from the Ohio Commission on Fatherhood, although we are starting to be able to offer some more targeted programs through some additional funding. In 2013, we developed the Mothers Matter program, and that was developed primarily in response to requests from those dads who were participating in our programs on behalf of the co-parents, the moms of their children, saying that, they didn't understand why there wasn't a program out there for them since there were programs out there for dads. So we did develop the companion program, the Mothers Matter program, with the hopes that we would be able then to incorporate into those classes the moms who were the co-parents of the dads or the children that the dads were parenting. What we found was while we had a great curriculum, we were really running into difficulty with the funding. So we were unable to obtain funding initially, and we began then to launch fee-based programs in 2014 and 2015. So the moms who came to the classes would have to pay a fee. We had some low participation initially, but it was enough to get our feet wet and get things going and to begin to build word of mouth and to begin to build the cases that we could submit with some funding proposals. We just recently received a new contract that's going to allow us to go into some of our higher risk neighborhoods, provide case management, no fees, and partnering with a faith-based organization there so that moms can participate in that program. From a co-parenting perspective, we have a unique approach to that in that we don't have programs that are specifically about co-parenting, but rather we incorporate co-parenting into our Father Factor and our Mothers Matter program. This all started when we started our program, Parents Who Parent Separately, back in 2007. And the way we do it is that we focus, as I mentioned earlier, on the dads and or moms understanding their roles in their children's lives. And then we focus on the parent-child relationship, and then we begin to focus on the co-parenting relationship. So at about the seventh session or the seventh time that each of the classes gets together, we start focusing on how to get along with the co-parent, the importance of the co-parent, looking at the parenting situation through the co-parent's eyes. What's nice about that is that when we are running the classes concurrently, we actually bring the classes together in that session so that the moms can hear the dads can hear the moms, but these are not the co-parents of their own children. And it makes them more objective and open to and hearing and understanding things from a different perspective. We have a lot of aha moments in there. As I mentioned before, the co-parents don't attend these classes together, so this is something that they're doing independently, but we find that it does result in co-parents referring other co-parents into our programs. From a domestic violence and safety perspective, we do ensure safety in our classes, so we make sure that co-parents are never attending classes at the same time in the same locations. Through our intake process and our case management, we do have opportunities to learn and identify then where someone may be a victim of domestic violence situation or may be the perpetrator of it, and we have community relationships that we can refer them to. We are, in this coming year, looking to enhance both our screening tools as well as our facilitator training so that we can address these issues a little more directly and in depth with the parents who come through our classes. Our benefits and challenges, we really feel that the participants who are coming to the classes, and this is based on their feedback to us, they're really having a much deeper understanding and appreciation for their role in their child's life and for the importance of being able to co-parent. Children need both of their parents, and our programs have really helped to reinforce that, and that then results in the referrals that come about. Our challenges continue to be funding to make sure that we've got sufficient funding to be able to offer our programs to those who need it, especially since we are spread out over a 7-county region. And like many of you, I'm sure, who are on this call, that initial engagement and participation is just really difficult. You know, there are so many challenges that our target audiences have, basic needs, just the whole stigma that goes along with parent education, and the complexities that are built into their lives. So we continue to look for ideas, ways in which to engage people, because our findings are that once someone becomes engaged, they stay with the program, they benefit from it, and then we can begin to just continue to enhance and affect and touch other people's lives. So thank you very much.
Thank you, Judy. And now, Anthony and Tashana from the Richmond Family and Fathers Association.
Yes, thank you, Jessica. I'm happy to be here. The Richmond Family and Fatherhood Initiative is situated as a program under the Virginia Department of Health, Richmond City Health District. And the program was founded in 2007 by our current Health District's Director, Donald Stern. And I think it's important to note that when Dr. Stern became Health Director for the city of Richmond, Like any doctor with a new patient, he examined the city's vital signs. Every health status indicator was worse than the state average in Richmond. This included teen pregnancy, infant mortality, out-of-wedlock births, STD infections, all functions of relationships between men and women. This data led Dr. Stern to what we feel is an inescapable conclusion that there is a crisis in gender relationships in the city of Richmond, and in particularly in the African American community. This being a painful reality, the Health District has promoted the RFFI program in such a way that we seek to create a community culture of connecting the city's fathers back to their families. By seeing our city through, our new vision statement is we are a city where children experience the benefits of fathers and mothers working cooperatively and responsibly to raise healthy children. 2 years ago, we embarked on a strategic planning process developed and assisted by Casey Family Programs, where RFFI employs a collective impact strategy model. And in that, we are the backbone support intermediary organization, and we provide overall strategic vision and oversight along with the resources and technical assistance to our community partners, our faith-based partners, and our partner government agencies. The data is clear for the city of Richmond. About 65% of the children and 86% of the African American children are born to women who are single at the time of delivery. Some in the fatherhood field may think that taking resources as part of their fatherhood programs to talk to, equip, train mothers somehow means a possible lack of emphasis on the dads, and that's simply not true. We strategically see linking the two makes a greater opportunity to meet our primary mission and vision of mothers and fathers working cooperatively together to raise their children in a healthy and responsible way. We cannot overemphasize the importance of our strategic partnerships to make that vision come to reality, and the referral partnerships that come along with that. Richmond City Juvenile and Domestic Relation Courts, its judges, the Richmond City Justice Center, the Trinity Family Life Center, the Department of Child Support Enforcement, our very own health department, and its other program of the Resource Mothers Program and the adolescent health programs. Our many churches, we have over 7 churches and faith-based organizations that work with us. We have Rubicon Substance Abuse Treatment Center that works with us. And finally, we have Carol Adams Foundation, who is our domestic violence training partner, who is leading that effort. She's actually a sergeant on the Richmond City Police Force, who runs the police force's domestic violence initiative. I'm going to turn this over to Tashana at this point in time. Tashana, will you continue forward?
Yes, good afternoon. RFFI has developed an intentional and purpose-focused relationship with other agencies and other entities as part of our 5-year strategic plan. And what we needed to determine was, who exactly had their hands on our city's mothers and fathers and who provided services to them. Also, if you look at our slides, you see some of our strategic partnerships and some of our referring agencies. Of note, I also wanted to add in Richmond City Health Department's Resource Mothers Program. And for those who may not be familiar with the program, that program provides free mentoring and support services to first-time mothers ages 19 and under. And, of course, we could not do the work that we do without, partners, Trinity Family Life Center and the Richmond City Justice Centers, along with the Rubicon and Carol Adams Foundation. Our referring agencies are the Department of Social Services and Juvenile Justice Center, as well as other organizations that have parenting programs themselves. Of course, we've had television PSAs, and another source of our recruitment and that we love to speak about is the alumni component. That is the last point under the Working with Mothers title. And with the alumni component, that is a vital link to data tracking for long-term outcomes for our participants, and that we use an evidence-based assessment instrument for that. These mothers are actually ambassadors for the program. We meet with them once a month, and to keep abreast with what is going on in their lives. Also, with our intake process, we've developed an organized intake process that speaks to our data points, and some of our key data points include the demographic information, which includes employment status, education level, the names of the biological mothers and fathers of their children. When we ask about education and transportation on the intake process, we're looking for any barriers that the parents may have. Another very important component of our new implementation model is that we are now gathering information on domestic violence, mental health, and trauma incidences that we may have. And we also are looking forward to the co-parenting and the parenting time piece that we have included in the intake process.
Thank you, Tashana. So as we move on to the next slide, I'd like to call your attention to our co-parenting intervention, our basic logic model for our interventions at the Health Department in Richmond City. RFFI seeks to move our overall initiative to an evidence-based practice. So as part of our strategic plan, we are implementing practices internally to try to move us to what we're deeming a evidence-based practice. And particularly in viewing our logic model that, by the way, will be implemented October the 19th of this year, we're starting obviously, Tashana just spoke to our intensive intake process where we're gathering those important data elements in our application process. Not only just to assign class location, but to begin the process of highlighting certain areas that may be pertinent in terms of other interventions that we may need to make available for our class participants. The first 2 weeks, as you see in the logic model, are our trauma-informed approach of our intervention, and we seek to increase the understanding of trauma, and particularly how early adverse childhood experiences can impact the participant lives. And we feel it's important that our participants, receive a greater understanding on how trauma in their lives may have impacted on some of the decisions, some of the behaviors that they're currently making. In that, and I need to emphasize also, this is an education component, not a clinical intervention. But we look to, in week 2, to help our participants develop what we call resiliency plans. At the same time, our facilitators are, for each participant, developing a case plan that, again, allows us very early in the curriculum cycle process to try to look to see if there are any flags that we may be able to bring to bear some additional interventions, perhaps with the Richmond Behavioral Health Authority and other through other community partners to be able to assist our class participants. In that we see our trauma-informed. Somebody move that slide back here.
Okay.
We see our trauma-informed approach as an essential component to our new intervention model, given the high prevalence of trauma among our city's mothers and fathers. Our program moves towards increasing trauma-informed principles as part of our internal program. And, we've read much literature, and we agree with the experts that taking this approach, implementing this approach in our overall fatherhood and motherhood program will help reduce the citywide stigma of mental health issues, both in our community and, to be honest with you, in our practitioner workforce as well. So we help to, in that, shift our community's vision in such a way that, the standard question of what's wrong with you to what's happened to you. We believe ultimately that's going to help our class participants to be in an environment that's more empathetic, but more strength-based. Our motherhood class participants then move to a 10-week motherhood curriculum component by the National Partnership, developed by the National Partnership of Community Leadership. You need to know that is an evidence-based program. The curriculum addresses the real-life experiences that our young mothers are challenged with. There are 18 group sessions that are designed to support, inform, and motivate in the areas of motherhood, parenting skills, and relationship skills. Our class participants then move to a 2-week co-parenting curriculum intervention where, upon completion, each participant is assigned a co-parenting navigator that will help navigate our participants. And what we find, when our dads graduate from our programming, they're all excited, but they just quite are not equipped and ready to handle that first intervention of conversation with mom. So with that, we felt in our design that a navigator that is trained and certified to be able to help facilitate that conversation between mom and dad is vitally important. So that's part of that process. We also recognize that when working with the biological father or the biological mother, that sometimes the tension is, even though they've gone through these courses, one or both have gone through the courses, the tension is still a little too high. And in our intervention, we have what we call co-parenting counseling, and what we have certified counselors to, if the participants desire to move into a more intensive one-on-one or, where appropriate, group or couple setting. The goal is simple: to get that couple to sign a co-parenting or a parenting time agreement. I would be remiss in saying that our class participants also have an opportunity in this model to participate in a mass graduation where our children and extended families are encouraged to come and see all the participants from across the city. We have more than 15 sites across the city in a coordinated graduation effort where we bring the families together. One, it brings a focus on the accomplishment of the participant, but it also impacts from a legacy perspective, because we recognize that in many of the families that we serve, this is the first accomplishment and honoring that many of our moms and dads have experienced themselves. But more importantly, they then become a model to their children to see mom and dad walking up across the stage and receiving a certificate of an accomplishment. We believe that modeling will impact the children in a very positive way. Next slide, please.
Thank you, Anthony. Can you kind of move it along so we can get to questions?
We absolutely will. Kashana, could you go ahead, please?
Yes, sure. Yes, as you can see, for the motherhood program, we have 83 mothers that enrolled and 35 graduates, along with 10 graduates of the domestic violence program, about 10 graduates of the DV and the motherhood and co-parenting program. With the Trinity Family Life Center, I just wanted to talk briefly about the highlights of each center and the uniqueness of it. At this facility, moms are provided with child care, transportation, and a dinner for mom and their children. We were trying to prevent any type of barrier that would cause mom not to be able to attend those classes. At the Richmond City Justice Center, we have Colonel Carol Dabney, who facilitates those classes. And because most of the women have already encountered her, at the Richmond City Jail. They have a trust there, and I'm sorry, she's at the Rubicon Treatment Center, which is a drug facility for women. And then we also have Richmond City Jail, where Alexandra James is, and she has built a wonderful rapport with those women that are in that facility. And then we also have the Carol Adams Foundation, and Carol Adams has the DV component there, which she does a wonderful job. Now, as you also see with the Fatherhood program, we've had 391 fathers involved, and 255 have completed. We must say and attribute a lot of our success to the NPCL curriculum, which was offered by Dr. Jeffrey Johnson. That offers an experimental design program, and it is absolutely awesome. The mothers and fathers have enjoyed that curriculum, and they're very much involved with it.
Okay. Any last words before we move on to questions?
Yeah, I just wanted to close out just by saying, just in general, we see our program with a level of magnitude of importance where moms and dad can, directly impact program outcomes. And we just want to also emphasize the importance that mom and dad work as co-equals in the well-being of their children. And our program, we help to stabilize that pathway relationship to mom and dad, which helps to stabilize and create a safety net for our children's well-being.
Thank you. We are going to open up for questions. I'm going to urge you to please be brief in framing your questions so that we can get as many in as possible. And while we line that up, the first questioner up, I want to ask the panel members to very briefly say what is needed to be more effective in engaging mothers and improving co-parenting. What's top on the list? Is it funding, mandatory referrals, incentives, other types of wraparound services? Leandra, what comes to mind for you? What's top on your wish list?
For me, it would be funding and incentives.
Okay.
A lot of mothers don't want to come if they're not going to get more than just that education, because they have to leave their children and can't feed them.
Judy?
Hi, yeah, I think it's also funding. I also think that we need to look at, just from a community-based perspective, what society thinks about parenting support. I mean, there's a stigma out there, and we need to work on getting rid of that.
Okay. Anthony?
I think I agree with the previous. Funding is certainly important, but I'd be remiss in saying that the need to set up a research methodology and helping through research, helping the practice to move forward.
And Paul?
I agree with what's been said. I mean, I think funding is really important. I would also say that, sort of reflecting back on that, what I said about Michael Liu's paper that came out, I don't know, maybe 10 years ago or so, is a real shift in mindset towards institutions inviting mothers and fathers together into the services that are already being provided, to really see the family as the co-parenting couple, regardless of whether they're together as a romantic couple.
Okay. All right. Do we have a question?
Jessica, you actually never let me give the instructions to open the line.
Okay, sorry.
So go ahead and do that real quick.
Okay.
The floor is now open for questions. If you have a question, press *1 on your telephone keypad at this time. Questions will be taken in the order that they were received, and if at any time your question has been answered, you can remove yourself from the queue by pressing 1. If you're using a speakerphone, we ask that while posing your question, you pick up your handset to provide favorable sound quality. Again, ladies and gentlemen, if you have a question, you have to press *1 on your telephone keypad at this time. I see that there are web users asking for access to speak, but you need to be on the phone lines in order to ask a question, and that's using *1. I do see one question here from Kenneth. Kenneth, please state your question.
Hi, I want to thank everybody for their time, and I am a recent graduate of the Family Studies program and currently a certified family life educator here in Flint, Michigan. We have a high poverty level, and there's little community involvement in the services, and as Ms. Davis spoke of, no programs to engage fathers, but it's also difficult to engage the mothers who are involved in a court order or mandated services. I wonder if there's any suggestions beyond actually going foot to foot in these high-risk environments and neighborhoods to encourage them and engage them to be active in this co-parenting style of intervention.
The question is how to engage mothers, and Judy, do you want to talk about that?
Sure. I think it's a challenge for all of us, to be honest with you, but the more that you can meet them where they are. So what I mean by that is recognizing that, in their role as a mom, in their life role, being able to, be empathetic and really meet them where they are, and then physically being where they are, going into the community. So it's not a door-to-door kind of thing, but it's finding those organizations that are serving moms in some way or another and developing partnerships with them so that you can offer additional services that your organization provides. Great.
Yeah. If I can add one additional thing, that I think it's, and I agree absolutely, but it's also important, I think, to provide child care for retention in a separate location from the class environment. So if you could have another room next door or something like that, I think that would be helpful as well.
Okay.
Great, thank you.
Another question?
Thank you for your question. Excuse me. Thank you for your question. Our next question comes from Philip White. Philip, please state your question.
Oh, yes. Hi. Just wanted to add, I'm from Central Virginia along with Anthony and Tashana. Just wanted to know from the group, are you using, as far as referral sources, for the motherhood and your fatherhood component when it comes to co-parenting, are you using the courts? We've been very successful here with establishing that collaboration through the courts because when you come to custody issues.
Okay, can we get answers to that? Using court referrals. Leandra, do you do some of that?
Yes, we do. Our juvenile court is where our never marries are, and our common pleas is where our divorcing programs are from. And so both courts do make referrals through their orders for our parent education classes. I mean, It's been a very effective tool when you have resistant parties.
Okay, thank you.
Mm-hmm.
Thank you for your question. Our next question comes from Maureen Bish. Please state your question.
Yes, I'm from Connecticut. Is there a particular category of mothers that are more, I want to say, receptive to getting involved in these co-parenting programs and really throwing their hearts and heads into this? Whether it's mothers of older children, mothers of, is there a particular category that you found?
Tashana, do you see any patterns that way?
Yes, I do. We see that they need to be very involved. Yes, ma'am.
Well, the question is, and maybe, Paul, your work involves very young, new parents. Is that when you see the most receptivity?
I do think that's, it's as far as whether there's been a comparative approach to sort of figuring out who's the most receptive. I don't know that that's ever been done, but we find that the earlier the better. That particularly, I talked about this window of opportunity for catching young couples, before the tensions get too great. Sarah McClanahan has talked about sort of the magic moment, and so I guess my general answer is the earlier the better to work with co-parenting couples. They're more likely to be receptive to what is offered.
Okay, great. Thank you.
Thank you, Maureen, for your question. As a reminder, if you do have a question, you may press *1 on your telephone keypad to enter the queue. Our next question comes from Ernest Dickens. Ernest, please state your question.
Yes, the PowerPoint presentation that you all presented has so much fantastic information. Will you be able to make that available to us?
Yes. The PowerPoint as well as the tape recording of the webinar will be posted on our website, www.frpn.org. So you will have full access to this, and we're delighted if you visit the website and use it.
Thank you.
And the slide now shows contact information for our presenters, so if you want to follow up and request any materials directly from any of the speakers, please, you can do so as well. Any other questions?
Yes, we still have questions. Thank you for your question, Ernest. Our next question comes from Diego Garcia. Please state your question.
Hi, I have two questions. The first one is for Paul. You mentioned that a recommendation could be having couples with programs when then most of the speakers talk about like group-based programs. I don't know, like, could you comment on that? Do you have specific research to support that recommendation? And the second question is for Judy, that you mentioned that the TAP is a fee-based program. So I just wonder, how has that been received? How is attendance? How much effort do you have to put to recruit participants versus, like what Paul recommended of giving cash incentives to increase participation? So that's kind of like contradictory.
Right. Okay. Paul?
Yes, I am. As I said, I think that the group approach is very valuable, and I understand why people take the group approach, because I think it really can be, parents can learn a great deal from each other. I do, in looking at the research, I have concerns that and trying to do group approaches, I have concerns that the logistics of getting, when you're trying to get couples in the same room together, the mother and the father in the same room together, the logistics of getting multiple couples can just be quite difficult. And so just for the logistics purposes, having a program that can schedule a single couple with a single provider, it has, in my read of the research, had a better recruitment and retention rate, because just for that reason. I also think that there's such diversity in where we're at, that being able to tailor programs to meet the particular needs of a couple has its benefits. So I really wouldn't say that I'm in any way against couples. I think we just haven't sort of pushed that dyad approach as far as we need to.
Do we have any research on bringing fathers and mothers together who are not related by a common child? That's approach that Judy described and others programs around the country do. Any research basis for their effectiveness?
I have not seen research on that. I'm kind of maybe see if anybody else on the line has. Jay may have something to say about that. I'm not sure.
Yeah, so you mean bringing mothers and fathers together who
right,
are related
but they're
by
not.
the child? No,
right.
I have not seen intervention studies of that nature or evaluation studies. No.
Okay. And then there was a question to Judy, the second part of. Yeah.
Yes. Thank you. To be honest, we do, well, the TAP programs, and we have multiple of them, have a combination of both fee-based as well as funded programs. Those programs that are fee-based, generally speaking, we are going to get the parents who are in a more middle income level. So we're generally in those classes not serving the parents who maybe are in the high conflict situations. As far as getting them to come to classes, we have not to date offered any kind of cash incentive or anything like that, but we do typically within the programs try to offer other incentives that will make it easier for them to attend or give them something at the end of their participation that will support either the child's development or the strengthening of the parent-child relationship.
Okay. Thank you.
For your question. Our next question comes from Adam Gettinger. Adam, please state your question.
Hello. I represent POPs in the Rios Coalition in California, and we did institute a voluntary moms program back in 2012, and it's been successful. But not to be negative, has there been much thought or discussion about whether the limited amount of fatherhood program funding would be further divided and diminished by including in the programs motherhood or co-parenting programming?
Okay. Does anyone want to respond to that?
If I can, this is Tashana. If a fatherhood program does not include the mothers, I kind of see it as being a disservice. Those fathers are going to be ready to be engaged with those fathers, but as Leandra spoke regarding mom as a gateway, if that mother is not ready, then sometimes, all of the training and education that the father has received, that would be futile. Mothers are a vital component because they have a hold most of the time on the children. And if you want healthy children, we have to try our best to get mom and dad engaged in that process. So you would be wasting money, if you continue to pour into these fathers but don't get the mothers as well as the children involved in that process. Fathers can't do it by themselves.
Okay, thank you.
For your question?
Can I ask a question?
Okay, go ahead.
This is Jay Fagan. So my question has to do with engaging mothers. The responsible fatherhood programs often are serving fathers. There's the fathers are the consumers of service. And knowing that fathers and mothers' relationships often can be very conflictual, and mothers may be reluctant to become involved in the program, in, let's say, a co-parenting program. If the father has already tried to involve the mother in those services, but he's not successful, what are the next steps? Should the program be reaching out directly to the mother? How does one approach the mother? That's my question.
I know what we do at RFFI as part of our intake process. We gather the names of the mothers and the fathers of whoever we're doing the intake process on, and we ask for their contact information. If by the time they get into class or if they're on the phone with me, and they state that they would want that significant other to be part of the program or would want someone to reach out to us, that is something that, we on our end do. We either ask a facilitator or myself will reach out to that other parent to see if they are willing to go through that process. So I know at RFFI that's something that we try to do.
Yeah, and if I could add to that, in our program, that's why the intervention of actually the co-parenting curriculum, the both focuses in the MPCL curriculum and the co-parenting curriculum on the importance, and the focus is really the child. So we try to move away from the conflict of the parent and get them to change their view sites to the child, because in most cases, that they do want to work commonly to raise the child in a healthy way. To your question, Jay, an outreach component of a program that will take the initiative to contact the other party, I would think would be a very important addition to any program curriculum.
May I add to that? This is Leandra. Here in Coshocton, we do a similar thing to what Tashonda was speaking of. Is when we do our intake, we get information on both parties, and we do reach out when one is not responsive. But we also offer mediation services so that they can try to come together to get an understanding of the importance of having that relationship, and if nothing else, work out a parenting plan that we like to try to have them start off incrementally. Because we know that there's trust issues, we try to have them create a plan that will allow the father to show his work through a supervised position maybe, or just gradually win back that favor. And it just takes another step to showing to the mother, I'm willing to go this far to do what I have to do to be involved in a child's life. So I think it is a strong testament to have a program that's willing to kind of advocate more so on behalf of the children when they truly work to pull both of those parents in.
It sounds like there's a negotiation that's involved between father and mother.
Well, through mediation, you can look at it as a negotiation, but they're really just coming together to talk about those differences and those barriers and getting an understanding of how to work out of that position that they're in and find favor in a position with being a positive father for their child.
Mm-hmm. Yeah, I just to chime in, I agree with everything that's been said, and I think that there's that process of negotiating and mediating often doesn't appear in the literature, but I think it's what a lot of us do out there in the field.
And if I can, this is Deshawn again, if I can quickly add, one of the success stories of the motherhood and co-parenting piece over here is that we did have a mother that was a part of our program who had been separated from her husband for 3 years, and she was ready to go forward with the divorce, but she stated that because of the information and the education and just being in the sessions, that her and her husband were restoring their marriage. And when I heard from her at that time, they had stopped the discussion of divorce and they were on their way to a family vacation, the first that they had in about 4 years. And so again, that's why we need to try our best to get mother and dad engaged, because it can be done.
We're nearing the end of the session. We'll tell the audience that we will be circulating an online survey in the next day or two, and we'd love for you to give us some feedback and also suggest additional webinars that you'd like to see FRPN sponsor or other type of outreach activities to kind of promote the field and assist practitioners and researchers. Do we have time for another one?
We do have one waiting in queue.
Okay.
All right. This next question comes from Sarita Rogers. Sarita, please state your question.
Sure. It's actually not so much a question as a comment. And it's in response to a lot of the discussion about how do we get moms, how do we make this work. I just want to say I think that having expectations in programs where moms and dads are equally valued works, and you train staff to that. You have performance measures to that. We have a home visiting program in Massachusetts where we're working with first-time parents 20 and under. So these are young parents, high conflict, all those things we've heard, and we've been very successful. We've got 49% of participants have at least one visit with both parents. The average number of visits with co-parents is 5 every year, so not just for the duration of their time. And our randomized trial evaluation shows that moms involved in our home visiting program move to more stable relationships with the fathers of their babies over time versus moms who did not participate in home. We've done it mostly by training staff, giving them a lot of technical assistance, and having expectations that moms and dads are both important. I think this has already been said, in the lives of their kids, and that they both need to be a part of it, and it can work.
Thank you. Thanks to our participants, our panelists for engaging in this first conversation about how to bring mothers into the dialogue in fatherhood programs about co-parenting. And we look forward to additional conversations about this. Any additional comments from Jay or Rebecca about next steps?
Yes, and any folks who have suggestions for future webinars that we might offer, please don't hesitate to contact us.
And check our website for the RFP announcement right after the new year for other research projects that will be funded by FRPN. Thank you.
Thank you.
Thank you, everyone.